All right. I want everyone to close your eyes. Are they good and tight? Good. I want you to imagine you're sitting at school in the cafeteria, surrounded by your friends. They're eating lunch. Everyone's just chatting away and eating. But then you hear this. Now, let's use your imagination again. Picture this. You're sitting in the window seat on an airplane. You have the book that you've been waiting on for months to read. You're trying to concentrate on what you're reading, but all you hear is this. Now open your eyes. How are you feeling right now? Do these sounds make your skin crawl or make you want to scream? Do you have no reaction at all? If not, you're one of the lucky ones. Today I'm going to explain to you what misophonia is, what causes it, and how it can be treated. What is misophonia? Basically, it's a hatred or dislike for certain sounds. In an article called Like Nails on a Chalkboard, a misophonia overview in the International OCD Foundation paper by Drs. Lewin, Storch, and Murphy, they explain that when someone dealing with misophonia is subjected to specific sounds, it causes sensitivity accompanied by emotional distress and even anger. Some people even go out of the way to avoid the sounds that bother them, like wearing headphones or by never going out to eat in restaurants. The most common sounds that provoke people with misophonia are things that are heard from like the mouth, like someone popping their gum between their teeth or popping their tongue. Another trigger comes from somebody's nose. For example, listening to someone snore or continuously sniffling. Yet another is noises that come from the fingers. Someone clicking a pen or someone drumming their fingers on a table. Although misophonia is not dangerous, it can have many symptoms. Now let's look at some of the causes doctors have discovered that explains why people may suffer from this disorder, as described in two of their findings below. According to James Cartwright, a medical doctor that posted in the Harvard Health blog called Misophonia When Sounds Really Do Make You Crazy, he says that a British-based research team using a functional MRI scan to measure brain activity. The team found that the anterior insular cortex, which is the area of the brain that's responsible for emotional feelings, caused much more activity in other parts of the brain during a trigger sound. Another finding in the OCD newsletter that I mentioned earlier, doctors stated that they found misophonia is commonly found in people that suffer from obsessive compulsive disorder, anxiety, and Tourette's syndrome. As I have discussed, there are several different causes that make people sensitive to sounds. As of now, there's no cure for misophonia. But let's look at some of the ways that can help manage the symptoms. Julie Ryan interviewed two different doctors in her article on the Healthline website called Misophonia, Tips of Coping. She said that there are 3 ways that could help. One is with tinnitus retraining therapy. This basically means that doctors try to retrain the subconscious part of your brain to ignore the sounds to the point that you're no longer triggered by the sound. The second way is cognitive behavior therapy. This therapy helps by using a device at ear level that streams sounds like rain and nature. Therapists say that this method shows a positive result in 85% of its patients. The third way is simply by supportive counseling. The counseling not only helps the patient deal with their feelings, it also helps the family understand what the trigger sounds are and how they can help the patient deal with them. You've now learned what misophonia is, what some of the sounds are that trigger someone with this disease, and even though there's no cure for misophonia, doctors can help you manage your response to your disability. So, the next time you're sitting with your friend and you're chomping down on that gum, cracking in between your teeth, or constantly clicking open and shut your pen, and you hear your friend let out a huge sigh, or they seem to be very agitated, you will hopefully now understand that some of the sounds that you're making could be triggering someone dealing with misophonia. Please go spit that gum out and lay that darn pen down. You may be able to help calm your friend's anxiety and help them have a better day. Thank you.